Welcome everyone to our webinar. My name is Mahrukh. I'm a medical doctor and a public health professional. Of late, I have been working with Center for Peace and Development Initiative or CPDI on a comprehensive program on air quality management. I'm very happy to be the moderator of this webinar. This webinar is one of the activities that we are undertaking to create public awareness about socioeconomic and health impacts of air pollution and discuss relevant policy and implementation issues in Pakistan. Please note that this webinar is being recorded and we will share the link of the recording later. I would also request all participants to please put your microphones on mute. Please note that this is an interactive session and participants can send any questions for the panel through the chat box, which you should find at the bottom of your screen. When we open the floor for discussion, you can also use the raise hand function of Zoom to ask questions. ख़वातीन और हज़रात, आज के वेबिनार में आप सबको खुशामदीद। आज के वेबिनार का बुनियादी मकसद ये है कि हम फ़िज़ाई आलूदगी के अवाम की सेहत और मुल्क की मईशत पर पड़ने वाले मनफी असरात का जायज़ा लें और साथ ही अपने पड़ोसी ममालिक ख़ुसूसन इंडिया और चाइना की फ़िज़ाई आलूदगी पर काबू पाने की पॉलिसियों पर गौर करें। Today we will bring your attention to the importance of clean air. Yes, the air that is a necessity for our survival. The air we breathe in 22,000 times every single day. To elaborate the importance of air quality, we are joined here by several experts from Pakistan, China, and India. Together, we will underscore the health risks of air pollution, explain how it affects public health and the economy, share evidence-based air quality improvement strategies from other countries, and explore opportunities for collaboration for formulating solutions and policies for cleaner air in Pakistan. Our speakers include Mukhtar Sahab, Executive Director, CPDI, Dr. Hongliang Yang from China, Dr. Ajay Deshpande from India, Dr. Zaim, Dr. Hira, Dr. Shakil, and Dr. Sajad from Pakistan. Without further ado, let me invite Mr. Mukhtar Ahmed Ali to give his opening remarks. Mr. Mukhtar is currently the Executive Director of Center for Peace and Development Initiative. He has over 20 years of experience in the field of democratic development, legislative oversight, right to information, budget tracking, governance, decentralization, policy reforms, and consumer protection. Mukhtar Sahab, the floor is yours.
Especially it is a problem around the year, but especially during the winters, we have been experiencing this problem of smog over the last several years now. And with every passing year, the smog becomes more intense. The period during which we used to experience smog is becoming prolonged, and more and larger geographical area is being covered by smog. It's having a huge impact on the quality of life of the people, on daily life. The health risks of people are increasing. There are many people who are asthmatic. For them, the situation becomes quite grave. Even the mobility gets affected. The motorways often get closed, for instance. They're closed for mobility because there's high risk of road accidents if the traffic is allowed in the smog period. Even, I have seen this, that even within the city, it's not possible to drive at certain times because the visibility, even within few feet or meters, would not be possible. So schools sometimes get closed. The children education is being affected, and of course, the people who are the poor people, the disadvantaged people, they're more vulnerable to the hazardous impacts of smog and bad air quality. So labor, for instance, the poor people who depend on their daily wages, they have to come out every day and do the daily wage. Now, if they cannot come out, if the transport is not available, if a road is closed, and if there is no mobility possible, also it affects their daily wages. So they may be not they may not be able to earn for the food, to feed their children in the evening. And similarly, the patients, the people who have some problem, if they need to go to the hospital, the mobility may not be possible. So it's having huge impacts on daily lives, on people's quality of life, and so on. Now, as a result, people in the urban centers who can afford, now they are gradually shifting to and they have opted for certain solutions, which may work for them at homes, whereby the air purifiers and so on, some gadgets available. But then, the rich people, well, while they can afford it, but the poor people have no such luxury. Even their houses are not built for it. They typically live in the open houses. So even if they have such gadgets available, they may not be able to use them uh, because they do not have insulated houses. Now, this problem, I know that while in Pakistan it's a big problem, I also have heard that it's a problem in India as well, and it's basically the same region. And which region contributes more to it, in terms of emissions or stubble burning or whatever, we don't know. But I don't know for sure. But what I've heard is that there are similar problems, on the Indian side and the Pakistani side. The sources are similar, or they may be same, and of course, effects are also similar. So you know I think that on the one hand, there is a need for a regional response. And of course, we can benefit from other regions as well in terms of technology, in terms of the solutions. China, I've heard, and Dr. Maruf was sharing that China has been very successful in, let's say, improving the air quality in the Beijing region. There may be similar examples from other regions. India, Pakistan also need to deal with this and through a regional cooperation. Unfortunately, the geostrategic situation is such that opportunities for regional cooperation have reduced. But I hope that at least for these kind of issues, at least we can cooperate. Similarly, within the countries also, we need coordinated national response. So in each country, India is also a federation, Pakistan is a federation. So we have local governments, we have regional governments, we have national government. Each government has a specific mandate, and very often they don't coordinate with each other. And unless they coordinate with each other, there cannot be any effective response or a solution that will work. Um, so, but I think these are my kind of initial thoughts or raw ideas. But we would like to learn more from the experts. Of course, there's a policy dimension to it. There's a technical aspects to it. So, what kind of technical solutions are available? What kind of policy reforms we need? And of course, there's a also a need for public awareness. And while people experience all this, unfortunately, at least in Pakistan, which I know more about, that while there's a fog problem, some policymakers and administrators, government officials may talk about it, and during that time they also hold certain meetings. But as soon as the problem goes away with the change of weather, they stop talking about it. So these days, for instance, we don't have this problem of smog, especially. So no one is talking about it. But I think once we will have it, the people will start talking about it. So which highlights the kind of issue that there's no consistent approach to it. Even media attention gets diverted. Civil society organizations' footprint in this area has also been quite weak. So there are lots of areas in which we need to do better. And I think it's very timely that Dr. Maruf Saiba took this initiative, and there's a lot we can learn about from other panelists and from other regional experiences. So thank you very much, Dr. Saiba. And again, lastly, I'm also once again thankful to all the panelists and participants. Thank you very much.
Thank you very much, Mukhtar Sir, for your opening remarks. So before I turn to the seminar proceedings, we will run a quick poll to check the pulse of this audience about the air pollution. The first question is now appearing, that should appear on your screen. Nosheen, I think I need your help here.
Yes, Dr. Maruf, do we need to launch the poll now?
Yes, please.
Yeah, sure.
As soon as the question will appear, then I will read it for the audience. Okay. So the first question says, do you have any kind of AQI app installed in your mobile phone? The options are yes or no. Question number 2 says, have you or your children stayed at home on a heavy smog day? Options yes or no. Question number 3 says, have you or any of your close relatives ever fallen sick during heavy smog days? The options are yes or no. Then the last question says, what is the name of the city you are living in? Please, audience, give your answers and we will discuss the results in a while. We can see on the screen that a large percentage of the people do not have an AQI app installed in their phone, and more number of the people saying that they or their children have been staying at home, like 68% of the people saying that they have to stay at home on heavy smog days. There can be multiple reasons. And okay. Wow, this is 78% of the people are saying that they or their close relatives have fallen sick during heavy smog days. Are we going to end? Okay, so we are going to end the poll now. And I'm sharing the results. From the results, it's very obvious. From the results, it is obvious that poor air quality is affecting the health, productivity, and quality of life. This also has implications on our economy, and we need to create more awareness about its harmful effects and prevention. Before we move to the speakers, I want to share with you. Yes. I want to share with you that CPDI is conducting a pulse survey on assessing the understanding of people about air quality in Pakistan. Although we will close the survey in end of September, I'm happy to share the preliminary findings with you. Until today, roughly 300 people have responded to the survey. And from the slide, we can see that our audience who completed the survey comprises 55% males and 45% females. Majority of them are bachelor's and master's degree holders. Some are PhDs as well. Most of the respondents belong to the cities other than the big cities of Lahore, Karachi, Peshawar, Quetta, and Islamabad. It's a good, next slide, please. Yes, it's a good sign here of public awareness that more than 95% respondents of this survey understand what is air pollution, irrespective of the age, gender, and education level. Then 60% of the people face bad air quality throughout the year, which is likely the urban population who live near roads with heavy traffic or industrial zones with high emission rate. They believe that air pollution is a serious threat to public health and is caused by multiple sources. Next slide. Yeah, other results show us that most of the people are aware of the diseases caused by smog, and they do use face masks and other precautions. And most of them check AQI scores sometimes. Installation of countrywide numerous air quality monitors can help them to know the accurate readings of AQI in their locality. Next slide, please. Analysis of the responses here depicts that while majority of the people believe that government is taking no actions to tackle this problem, At domestic level, they do not have air purifiers or filters at home. The question is, what is stopping them from buying air purifiers for home, schools, or offices? There can be multiple reasons for that, like no awareness on the existence of air purification technology, no market or advertisement of air filters on electronic or social media, a lack of trust on the technology to help purify the air in the ambient environment, or simply lack of affordability. The purpose of this survey was to assess the understanding of general population about air pollution. However, the limitation of this survey is that the population sample is not representative of the entire population, which also include people who do not understand English or who do not have a smartphone to receive this survey. We will also share the link of the survey in the chat box later. If you haven't already responded to the survey yet, please take the survey after the webinar. Now let's move to our speakers who are keen to share their wealth of experience and expertise with us. First of all, I would like to invite Dr. Zaim to give his presentation on public health risks from poor air quality in Lahore, its assessment and future direction. Dr. Zaim is an assistant professor. Can we have this slide for his introduction? Dr. Zaim is an assistant professor at the Institute of Energy and Environmental Engineering, University of the Punjab, Lahore, with over 6 years of experience in industry, teaching, and research. He is also an active environmental consultant dedicated to evidence-based environmental change. Over to you, Dr. Zaim.
Thank you very much, Dr. Maruf. I hope all of you are safe, happy, and healthy. And I also hope that I'm audible and you can easily, access my screen also. Thank you very much, CPDI, for this initiative. I'm Dr. Zain Babar. I won't be going into more of my introduction. This is the title of my presentation. It is Public Health Risks from Poor Air Quality in Lahore, Assessment and Future Directions. This is the outline of my presentation. Initially, I'll be discussing pathways and the status of air quality in Pakistan in general. Then I'll take Lahore as a case study and I'll be analyzing monitoring data of two different stations, considering PM 2.5 and other hazardous gases, including NO2, SO2, and CO, and then the corresponding health impact assessment as per US EPA protocols. Lastly, I'll be talking about mitigation strategies. I'll be discussing technical and policy-based interventions. So this is the World Air Quality Report back in 2019. This is Pakistan. You can see the corresponding levels over here that range between 55 to 150 micrograms per cubic meter of PM 2.5. Here is China. So back in 2019, at that time, the WHO permissible limit was 10 micrograms per cubic meter. So for the case of China, the range was 35 to 45 micrograms per cubic meter. Now, this is the latest World Air Quality Report. It is in 2023. So you can see for the case of Pakistan, the situation is similar with PM 2.5 levels as high as 50 and above and lie in the hazardous range. Whereas for the case of China, there is a significant improvement and they have dropped their annual concentrations in the range between 25 to 35 micrograms per cubic meter. And that is just because the three main sectors such as their research institutions, universities, industries, and their government institutions, they are all on the same page, and they consider poor air quality as a national issue, and they are collaborating intensively to mitigate it, and they are quite successful over the period of last 10 to 12 years in this regard. Let's talk about pathways of how this poor air quality results. So we have VOCs, volatile organic compounds emitted from various sources, such as plant and vegetation, industrial sources, vehicular emissions, fossil fuel burnings, biomass burnings, including agriculture residues. Uh, we have also some residential and commercial activities such as kitchen emissions. So they react with different gases such as SO2, ammonia, and NOx. And OH radicals are very prevalent in our atmosphere. In the presence of UV rays from sunlight, multiple atmospheric reactions actually happens, and they result to form secondary particles. So these secondary particles, they can be the part of PM 2.5, PM10. Ozone is also formed during these reactions, and they have very wide range of composition, including alcohols, nitrates, peroxynitrates, and carbonyls. Simultaneously, there are some sources which directly emit particles into the atmosphere. So, and then there is a role of humidity from water sources. So this whole basically complex mixture of gases, secondary particles, primary particles, and the reactants as well, they lead to poor air quality. So this is basically the prime phenomena why in Pakistan or in our regional countries the poor air quality actually happens. So this is the AQI index of major cities in Pakistan, including Lahore, Faisalabad, Karachi, and Peshawar. You can see the AQI levels after COVID in 2020, they are significantly increasing in most of the cities such as Lahore and Karachi. And they lie in unhealthy range, which means that if the AQI is between 150 to 200, that is very unhealthy for general population. This is last year in November 2023. This is the list of top 10 polluted cities globally, and you can see Lahore over there at the top with US AQI up to 392. And the corresponding scale, AQI scale, the levels are in hazardous range. So this is a very terrible situation of air quality in general in Pakistan and specifically in Lahore. In Pakistan, it is reported that almost 135,000 people die just because of poor air quality each year. This is reported by WHO. So this is one of the data slides. This is the graph of PM 2.5 monthly averages. The blue bars, vertical bars are PM 2.5 levels. The red line is average monthly temperature. The green one is average wind speed, and the light blue one is rainfall. So in Pakistan, in general, December to Feb is considered as winters, and then there is a pre-monsoon between March to May, and monsoon between July to June to August, and the post-monsoon is from September to November. So if you see the relevant values, I'll be just comparing monsoon and winters for the sake of understanding. So PM 2.5 levels in winters, they are approximately, for the case of Lahore, this is a residential area, remember. So the levels are around 200. With low temperature, ambient temperature, with relatively low wind speeds and minimal rainfall. So if you compare these values with the monsoon season, you will see the PM 2.5 levels are significantly lower, but still higher than WHO and National Environmental Quality Standards of Pakistan. These are their limits. So wind speed is quite high, almost 2.5 to 3 times higher than as compared to that of winters, and similar is the case of rainfall. So you can see the effect of weather is there, specifically wind speed and rainfall, which are primarily associated with the wet deposition as well as dispersion of the pollutants. However, regardless, if you see monthly averages, you can and compare it with to WHO and NEQS levels all across the year, in each and every month, the monthly averages were significantly higher than the WHO limits. They were approximately up to 38 to 40 times higher than WHO limits and 13 times higher than NEQS limits of Pakistan. And this is similar is the another station at US Consulate Lahore. This is for year 2020. Similar pattern, similar results. Uh, it can be easily seen that in winters, due to weather conditions, primarily due to weather conditions, the status of poor air quality becomes aggravated. and the levels are very, very high, up to as high as like 200 micrograms per cubic meter. So the bottom line is, in Lahore and in general in Pakistan, the air quality situation is very, very alarming. So this is the all other data just for the representation. You can see, you can have slides later on, and you can see this from this data that the trends are exactly similar at different locations at different years. But overall, you see in winters over here, in winters over here, and also in winters over here, the levels are extremely, extremely high. Regardless of the months, the overall in each and every month throughout the year, the levels are also very, very high as compared to permissible limits of NEQS and WHO. And similar is the case for the gases. You can see in winters, uh, this is for the case of NO2. So this is one of these studies which were actually conducted back in 2021 and 2024 by Tabinda and Shazadi and colleagues. So I just used their data from the literature, and I analyze it by myself. So you can see same thing, same trends. Monsoon, it is quite low, and in winters it is quite high, and it is primarily associated with the weather conditions of low rainfall, low temperature, as well as low wind speeds. Let's talk about health impact assessment. So this is the bar chart of DDF, which is daily dose. So that is basically per day, the micrograms of those particles which are inhaling, which are being inhaled by a certain category of population per kg of their weight. So you can see they are touching around, they are in general in the range between 150 to 200. However, at some instances, they are as high as 400 and 600 respectively. I have used the following background data of the population category as well as their body weights and inhalation rates, and I have used the US EPA protocols for the estimation of these DDFs, daily dosages. This is the criteria. This is the permissible limit. So you can see for the case of WHO, for mature adults, children, and infants, the permissible limits are 1.19, 1.69, and 3. And this is corresponding to NEQS. And you can see, but in actual, the DDFs in the field that that in general the population is being exposed to is extremely, extremely high. It is touching 200 and lies around 100 to 100, between 100 to 200. And that is very, very high if we compare them with the permissible limits of WHO and NEQS. So it is approximately in general, roughly 50 folds higher than the permissible limits, irrespective of the age groups. So this can be easily translated into the severity of air quality issue in Pakistan, and specifically in Lahore. And this is the monthly averages for the case of township in 2022. The HHQ criteria, this is health hazard quotient. The criteria is 1, which means that if the value is 1, then the health impacts are negligible. But if the values are higher than 1, then obviously there are health impacts. And you can see from over here, the values are in the range between 10 to 50, which are compared to WHO, and 3 to 15 times higher when they are being compared to NEQS limits. So, and that is one of the reasons why the residents of Lahore are on a track to lose approximately 3 to 5 years of their life. I will just go to the results of this slide. These are basically results of source apportionment studies. These are technical studies which are being used by researchers and scientists to find out the quantified contribution of various sources. So the result shows that, and unfortunately, in case of Pakistan, and specifically in case of Lahore, not in case of Pakistan, but in case of Lahore, in last 10 to 12 years, there are only 4 source apportionment studies. Only 4 sources, and that is very, very less, very, very less if we compare these source apportionment studies with even China or even India. So the results show that vehicular emission contribution is almost 33%, and the second is biomass burning, which is 25, and then there are some industrial emissions which contribute to around 22. And now these are some technical interventions. I strongly believe that the low-cost sensing network can be a very significant step in terms of monitoring and assessment of air quality for not only for the general public, but also for researchers and scientists. specifically when it comes to Pakistan, which is a developing country which has economic issues. So the operational cost is around 200 to 1,000 US dollars, operational plus capital cost, as compared to BAMs or reference grade monitors, which are highly expensive and their maintenance is also very, very high. Currently, low-cost sensors are being used in US, China, Hawaii Islands, Puerto Rico, all across the globe, even in Uganda and Lebanon. And they're being used effectively for advocacy purposes, for air quality monitoring, and for identifying levels of various pollutants for not only for the general public, but also for government organizations. And secondly is source apportionment studies. Now you can see for the case of China in last 30 years, the number of source apportionment studies are more than 250. However, in case of Pakistan, there are less than 20 source apportionment studies. So that is why China is actually following evidence-based policy making, and that is why they are very, very successful in mitigating air quality, specifically in last 10 to 12 years. Secondly, there are some indigenous solutions. I think we have in Pakistan heavy duty diesel vehicles which are as old as like 20 years, 25 years. I think effective and efficient particulate filters, their development and deployment can play a very significant role. Similarly, is the case for field burnings. India has also developed an enzyme known as PUSA, that on paper that is very, very good for decomposition of the residues, but I'm not sure about the actual practicality. But there are some other solutions such as utilizing agricultural residues as a solid fuel and co-firing of those residues with the local coal for energy generation purposes. Lastly, and but not least, transboundary pollution. That is one of the issue which for which the data is very, very scant. I think we need to have a regional collaboration between the regional countries, and I think we need to devise methodologies for quantification purposes. Lastly, it is smoke chamber facility. That is one of the very highly scientific thing that is being used for assessing the processes that are actually happening in a certain environment. I think, but later, after 5 to 10 years, I think the applicability of these smoke chambers will be very crucial in case of Pakistan, depending upon our scientific development and understanding. I think for all this, again, a triple helix model of innovation is very, very important, which means that a very comprehensive and integrated research is required to solve these national issues, specifically, which is associated with poor air quality in Pakistan. Um, so these are all medium to long term approaches. I think if we implement, I have also highlighted which one is short to medium term and which one is long term. They can all effectively and effectively utilize to assist policymakers and public agencies and even NGOs to and public bring agencies and about
Dr. Zain, we cannot hear you.
I just need a minute. I'll be able to wrap it up.
Yeah. Your voice has. And please try to.
So vehicular emissions, considering vehicular emissions, which can be either in case of developing countries, the emission test is mandatory for all the vehicles to be on the road. But in case of Pakistan, there is no asset policy that is existing. However, in 2016, um, there is a program launched by Punjab government, which is WIX. So I think if we can implement WIX and if we make mandatory the emission test, that would be very, very helpful in mitigating air quality. Secondly, it's all about emission standards. I think in Pakistan, we are following Euro 2 emission standards. Globally, Euro 6 or equivalent emission standards are being followed. I think we should consider implementing stricter or Euro 6 emission standards. Lastly, it's about biomass burnings. I think we need to train our farmers for productive practices such as composting and mulching. instead of burning it, so that they can be fruitful, not only in terms of economics, but also in terms of mitigating air pollution issues. Lastly, it's about public awareness. I think the media has to play a very significant role. Outreach programs by NGOs and educational institutions, they can also have a very significant impact. And lastly, citizen engagement and advocacy. So utilizing certain youth groups and clubs to advocate for the policy changes specifically which are relevant to air quality monitoring and assessment. And last but not least is public protective measures. I think we have to, this is also evident from the surveys. We have to utilize indoor air purifiers. I think this is very, very important because affordability is one of the crucial parameters. I myself working on an indoor air purifier, I have also developed it. That is totally indigenous. I am looking forward for the commercialization also. The cost, the thousand rupees, which is very, very high. Families in Pakistan cannot afford it. So it is not a luxury. Air quality, breathing in a good air is mandatory for everyone. I think it is the right for each and everyone to have a very healthy, good air quality. So that is why, having that motive, I'm working on developing these air purifiers, and then avoid localized burning of the waste. In Pakistan, it is a very normal practice. We burn our waste, and that is which actually significantly contributes to poor air quality. I think if we consider all these measures, we can, in next 5 to 7 years, we can have a very good impact, and we can control
Dr.
the
Zain,
situation
would
of
you
poor
mind
air
please wrapping
quality in
it
a
up?
very well and
We are
organized manner.
short of
Thank you
time.
very much. It's done. It's finished.
Thank you. Thank you very much. Thank you very much, Dr. Zain, for such a rich presentation, so much informative. And now, please allow me to ask you a quick question. What do you think are the key reasons for the underutilization of AQI monitoring devices and air purifiers in Pakistan?
I think considering monitoring devices, it really depends on the policymakers. So because obviously those policymakers are actually responsible for developing certain strategies and utilizing these air quality monitoring devices at various places within Pakistan. I think it really depends on them. But as a part of academic and as a part of general public, I think it is very important for us to develop awareness and to have certain sort of data which can assist all the policymakers and influence them to have to have a comprehensive air quality monitoring systems in Punjab, in Lahore, and in Pakistan as well. And considering your second part of question, I think it is very, very important that indigenous development said the cost of a single air purifier in Pakistan is around 50 to 60,000 Pakistani rupees, which is not affordable by an average Pakistani family or guy. I think in this context, indigenous development is crucial and important. As I have also the preliminary data, and that is working very, very good. Alhamdulillah. I mean, let's say if the values are 300 micrograms per cubic meter, if the initial values are 300, the air purifier can go as low as 30 micrograms per cubic meter in a single room in a span of around 3 to 4 hours. So that thing, indigenous development.
Dr. Zain, we cannot hear you. And due to the shortage of time, I would like you to please wrap up, and so that we can go to the next speaker. Can you hear us?
Yes, I think there are some issues in internet
Yeah.
connection. So sorry for that. But obviously,
Anyways, thank you very much, Dr. Zaim, for your such a valuable informative presentation. And now please welcome our honorable guest speaker, Dr. Hongliang Yang from China. Dr. Hongliang has extensive experience in international development. He has led several large-scale infrastructure projects for improving air quality in China. Currently, he serves as the Principal Investment Solutions Specialist in the Sectors, Themes, and Finance Solutions Department, STF, at the Asian Infrastructure Investment Bank, AIIB. Dr. Hongliang, I would like to ask you my first question. I hope you can hear me now.
Yeah, thank you very much for your introduction. It's my honor to attend this webinar. I listen, the presentation delivered, with a great interest. And I would like to share my experience, in this sector.
Thank you very much for coming. It's actually our pleasure to have you on board. And with this, I would like to ask you that now the world knows that there has been more than a 50% reduction in PM 2.5 levels in China over the past decade. So in your view, which are the most effective policy interventions that have worked in China to improve air quality? Over to you.
Thank you. This is actually a very, the interesting questions, but from the China's perspective, and also, from, the energy, professionals' perspective, there should not be any one policy. It should be a framework of policies. For example, when you want to address the air quality issues, you need to have, the energy policy, to make the energy supply cleaner, to ensure the energy supplied, there is a progressive the path for the fossil fuel based energy system to be transitioned to a clean energy based system. For the industry sectors, you need to have a set of policies to promote the energy efficiency enhancement and improvement, and at the same time reduce the pollution. For the transport sector, you may use another set of the policies to promote let's say the more efficient vehicles, or even promote the transition from fossil fuel based vehicles to the EVs, to electrified vehicles. So it is difficult to say which policy is most important, but we cannot let's say, discuss the air quality issue without considering the specific issues in the country context. Let me give you some examples. Started probably 20 plus years ago, China already, issued a lot of policies to enhance the energy efficiency in the industries, in the power generation, in the transport, in these sectors. But, but at the beginning, people do not pay so much attention, to this issue. But starting from, the year 2010, when the air quality became a problem in China, so more and more people realize that China facing significant environmental challenges. Some studies even telling, the cost, for the economic growth due to the air quality, the problem is the cost, the GDP, is around 3 to 10%. That's already been very high. If this issue cannot be properly solved, that means in the future, the economic growth in China over the long term will not be sustainable. So since then, the Chinese government, particularly, for the air quality improvement, they issue a lot of policy. Let me name a few. The China's context is quite different from many, other countries. China has, domestically have a lot of coal resources, but it does not have, let's say, sufficient natural gas, resources. So in the past, the coal actually take a very big share in the energy supply. So due to this reason, the pollutants from coal combustion have been a major source of air pollution. In the rural area of Beijing, for example, households rely on the coal for cooking and heating, which is a major contributor of total, particulate matter less than 2.5 microns in diameter in Beijing. PM 2.5, in Beijing. So to help improve the air quality and reduce pollutions related to coal combustion, the government issue a series of policies. For example, is in 2012, the Chinese government launched a nationwide comprehensive action plan for air pollution prevention and control. This air quality as a national, the improvement as a target also mentioned in the 13th five-year plan. 13th five-year plan is for the period between 2016 to 2020. The 13th five-year plan reaffirmed the government's commitment to accelerate air quality improvement and included mandatory targets. The central government actually set up some mandatory targets for the local government. And also the Ministry of Environment regularly disclose which city already achieved that target, which city has not achieved that target yet. For those cities, they already achieved the defined target, and then they can get an award. For those cities, which does not achieve the target, it's maybe get a punishment in certain way. So later on, the policy was found very effective. Do I make myself clear?
Yes, clear.
Yes, it's very clear.
Yes, thank you very much, Dr. Hong Yang. So I think I totally agree to the points that you made, that good governance and good legislation can lead to good implementation of the policies. So, for Pakistan and China, the two things that we share is we have big population and almost like similar demographics, but and also the coal combustion is also one of the major, the fuel in Pakistan. So I really hope that our policymakers and our politicians and all the people who can be the stakeholders, they can get good lessons from China. And with this, I would like to ask you another question, if you don't mind, and that is that developing countries have significant financing needs to prepare and implement air quality improvement projects. What will be your advice for structuring such projects and securing financing, especially from NDB?
Yeah, this is a very important question. Financing needs, of course, is something if we want to really invest, let's say on air quality, we really need financing. For that, I have a couple of points to share. The first thing I would like to mention that all the stakeholders should play a proactive role in the air quality improvement. The first stakeholder I want to mention, probably the government, because air quality, in some way is a public good. We cannot purely rely on the private sector to solve this issue, either in practice or in theory. We cannot purely rely on the private sector. But the government really need to define the market rules to attract the private sector into this area, into this field. I give you some examples. In 2016, when the air quality issue in Beijing was still a problem, AIIB actually worked with the gas utility companies, which supply natural gas to the Beijing area. We provide a $250 million loan to them to help them to expand their natural gas supply network to the rural villages outside the urban area of Beijing. We provide, the gas connections to more than 210,000, households. The project beneficiaries is more than 1 million, the rural people outside Beijing. By doing that, actually, at the government side, the government, they provide a better, the public good, to the citizens. At the, the enterprise side, at the company utility side, because the loan helps them to expand their gas supply network. That's their own business. These actually kind of investment also increase their revenue and also profit. They are also the beneficiaries. Not only the general public benefit from the air quality improvement, the utility companies also benefit from the expanded business. So they are also beneficiary. For the MDB, for AIB, we are also one of the beneficiaries because through our investment, we establish our green image in the market. That's actually very much aligned with AIB's the mandate, and also we help the members to make their economy growth more sustainable. This is the first thing I want to mention. The secondly, I think the researchers, the universities, and research institutions, also need to play a very proactive role. When we look at the air quality, improvement, because the pollution resources can be discarded in everywhere in the country. So the first thing we need to identify, as mentioned in the previous slides, we need to, identify what is, the major, pollution resources. And then, the research institutions, and also the consulting companies need to work based on the, based on the data, to pack all these kind of activities into a bankable project. When you have a bankable project, that's the time, to discuss with the financiers. Let me stop here. Thank you.
Thank you very much, Dr. Hong Liang, for such an informative talk. And I totally agree that in addition to MDBs, the research institutions, they have to play their role. And I believe, and I really hope that that day is not far when Pakistan will be in a position to achieve our goals for not only the climate change, but also for reducing and mitigation the air pollution. So Dr. Hong Liang will leave the webinar early, so due to his prior commitment. So if anybody wants to ask any question from him, please raise your hand or write it down in the chat box. Now I would like to invite Dr. Hira Anwar to discuss the policy and economic perspectives of air pollution in Pakistan. Dr. Hira is currently the Deputy Director of Human Resource in National School of Public Policy, Lahore. She was previously the Section Officer in Establishment Division and Economic Affairs Division. She has worked as Assistant Chief of Health with the Planning and Development Department of Punjab. She brings extensive research and policy experience with her. Please go ahead, Dr. Hira. And just a reminder that please stick to the time limit because we don't have time left. Thank you. Over to you, Dr. Hira.
Assalamu alaikum. Hope everyone can hear me. Dr. Maruf, can you help me in sharing my presentation? Am I audible?
Yes, Dr. Hira, you're audible.
Yes, Dr. Hira, just give me some time.
while we are waiting for the presentation to get ready, I'll just go with the some overview on this climate change policies in Pakistan. So this seems to be a new news for us that we had been trying to conserve the environmental conditions since back in 1927 in the subcontinent. But yet again, in 2024, we are still lagging behind the major countries. So climate change has emerged as a global threat all over the world, and it is equally affecting Pakistan as well. Rather, Pakistan is in red zone countries that are to be affected by climate change. Can we get the presentation, Dr. Maru? I think I lost the connection. Am I audible?
Yes, you are.
I'm just waiting for a response from Dr. Maru.
Dr. Hira, the presentation is shared. Please carry on. We are short of time.
So I just cannot see it.
ये भी स्पुटम आ रही कि नहीं सकते नहीं कल्चर वाला करने
It is not visible to me, Dr. Maru.
Dr. Hira, if you have a presentation with you, you can share directly.
Yes, I'm trying to share it now. Okay, this starts sharing now.
The best.
मैं प्रेजेंटेशन पे आईटी वाले बंदे को साथ लेके बैठा होता हूँ टोटली डोंट बिलीव इन आईटी खुद से करने में
The host was not allowing me to share now, so it's sharing. So the topic for me today is air pollution in Pakistan. I will be having a policy perspective. So this is the current pollution status in Pakistan. Lahore is ranked as the second most polluted city in 2024, where particulate matter concentration in Lahore is currently 10.16 times the WHO annual air quality guideline values. This is the main concern that we are all here today. So Pakistan has different policies in hand, and there is a climate change performance index ranking for all the countries. Pakistan's policies are ranked as 30th overall. This means that Pakistan is a medium performer. The reasons are that the policies are ranked low in energy areas, and because there are no clear policy for fossil fuel phase outs. In comparison, India is ranked as 8th in the policy performers. We have a potential area here that Pakistan has very low GHG emissions. This is the area that if we put an effort, we can get them to the targeted value and benefit it to achieve our targets. So I will just touch up the socioeconomic impacts of air pollution. Other participants have talked about it a lot. So the healthcare costs involved two different types of costs. They are in terms of finances and in terms of personnel. So we are losing $50 million a year to the climate losses. This involves natural hazards. This involves a vicious cycle that we are trapped in, that climate hazards, they cause natural disasters, and natural disasters then further cause financial losses and leaving us not performing in the climate mitigation areas. So in 2015, only 60,000 person died in Pakistan due to fine particulate matters due to various diseases, and 22,000 adult death per year are recorded in Pakistan that attribute to the climate hazards. And in terms of
हाँ बेटा
productivity
इस
in
तरह किया
2000,
करें, अभी तो हो जाएगा, ठीक है। उधर से जो देख लिया अब, ऐसा करना हो तो इतना क्लियर होना चाहिए।
in
अच्छा,
2000
अभी
in
ये देखो
2000
ना, ये शुरू है।
सर
in 2000
आपका माइक अनम्यूट है, काइंडली उसको म्यूट कर लेंगे।
In 2017 only, 180 factories in Pakistan were shut down due to such climate losses and climate hazards. And as it was also shared earlier, that flights are suspended, motorways are closed, and this further leads to unseen losses. In agricultural productivity in Lahore in winter season only in 2023, there was a recorded reduction of 46.7% to 34.8% crop yield. So we will majorly talk about the current policies in Pakistan. There are a lot of policies in Pakistan. There are a lot of paperwork. It's all available on internet as well. But we will start with the framework, how the government works in Pakistan. So before the 18th Amendment in 2010, climate change was a federal subject. It was handled by the Ministry of Environment and Disaster Management. And after 18th Amendment in 2010, the climate change subject was devolved to the provinces. So this causes a basic gap here because the international ratifications and alignment with the partners, they are to be still carried out by the Ministry of Climate Change in federal government. But according to the 18th Amendment, provinces are free to achieve their targets and set their own goals in terms of any areas that have been devolved to them. So this is the basic policy gap that we need to address. Provincial climate control framework is not clearly defined yet, and it is not aligned with the federal policy as well. So we will discuss some famous federal level plans first. So there is a National Environmental Action Plan in 2011. Sorry, 2001. It was adopted under the Environmental Protection Agency. So you will stay with me and see that how the executing agencies and implementation agencies are changing over the time. So this plan was adopted in 2001, and the objectives were alleviating poverty. So this seems to be a far-fetched idea. How are we relating the alleviating poverty objective with the climate control? So this is important. Rationale behind it is that poor people, they rely more on natural resources, they rely more on available fossil fuels. So that was the rationale behind this policy. It targeted air pollution as its core program, and it had some partly achieved targets as well. That is introduction of unleaded gasoline and reduction of sulfur in diesel as well. So this plan also addressed the areas of gender equality, water quantity, and it had around 300 development projects and plans. And the plan was successful in its first phase, where it involved the paperwork, where the policies were to be launched. But in the second phase, it turned out to be a complete failure, and it was attributed to the political instability. So in 2019, this National Electric Vehicle Policy was launched under Ministry of Climate Change. This policy is also mentioned in our National Climate Change Policy, and this has also been included in our NDC. And the targets include the vehicle generation up to 30% vehicle to be electric by 2030. This is the goal that we share with India, and 90% by 2040, which still seems to be very far-fetched. This policy proposes an incentivized and a phased approach for achieving the penetration targets. The first phase involved the market development. So we are still lacking in it, and the public awareness is still not being developed, and rest alone, the third phase of that involves fuel substitution bills. So minimum penetration targets were identified in this policy. It's still ongoing, and we have yet to see its results. So this is the national climate change policy that was updated in 2021. It was back in 2012, but later it was updated multiple times to align it with our NDC objectives. So the main objective of this policy is to promote possible extent of mitigation in a cost-effective manner. So now we are turning to the real problem that we have seen, that climate financing has been an issue for the Pakistan. We are lacking finances, so we are now looking forward towards climate actions that are cost-effective. The first step towards the right direction. The current NCCP highlights Pakistan's targets and its directions as set in its UN Climate Ambition Summit. These are outlined as the 60% energy is to be produced through clean and renewable resources till 2030. So we have just seen that we still not have any fossil fuel policy. So this seems to be a difficult target for us. And then 30% of the current vehicles to be electric vehicles, and imported coal power plants should not be pursued. We are still lacking the coal policies and energy policies in our country. And it also involves the Clean and Green Pakistan initiatives and the 10 billion tree tsunami program. This is the first policy that started citizen engagement at some level. So this outlines citizen engagement at 3 levels. First is to be self-help, that you clean your community, help achieve climate targets in your community. Then is that second step is that you work in collaboration with local government to achieve the climate targets. And the last phase is to be that you work as a whole as a nation towards achieving your targets. So this is the Pakistan Clean Air Program, the PCAP 2021. This is the program that led to the creation of country's first national air pollutant inventory. This inventory quantifies black carbon and other pollutants, and its major goals involve determining air pollution concentration targets and identifying strategies for mitigation air pollution, and develop a coordinating air quality improvement action plan. So this is basically targeted at the 3 major areas that cause pollution in Pakistan, and particularly in Lahore, that involves burning of the crop and agricultural waste, and brick kiln and industrial emissions, and fuel inefficiencies. So this policy and other policies include the National Drinking Policy in 2009, National Sanitation Policy in 2006. These all were the framework of policies. As Dr. Hong Liang already suggested, that we cannot work in direction of one policy. We need to bring a framework of policies that work in multiple sectors and then align our goal towards one objective. So the provincial level plans, as I already discussed, that provincials have the autonomy to decide their plans, but they are directed to align their policy with our national climate change policy and to achieve our NDC's objectives. So the second flaw that is highlighted here is that the national policies, they are not binding on the provinces. They are not laws. They are not regulations that are to be abided by in any case. So they are just suggestions from the federal government that are to be aligned by the provinces. So the provinces, they formulate their policies under Pakistan Environmental Protection Act. It started around 1983 as an ordinance. Then it was later improved to an act. So currently, only 2 provinces, Sindh and Punjab, and 2 cities, Lahore and Karachi, they are working good in the direction, and they have developed their clean air commissions, and they involved these policies. They involve other stakeholders, that is clean air, some Swedish NGOs and other sectors as well. So gradually we are moving towards NGO and stakeholder involvement, and this is how our vision towards a collaborated national approach is developing. So the other policies that are provincial level are the Canal and Drainage Act 1873, the Forest Act 1927, Pakistan National Conservation Strategy of 2006. So you see that the policies are already there, the paperwork is already there since so many years, but it's still not been implemented due to number one, and number two, that keep on changing the executing and implementing agencies. So these are some challenges that are related to the implementation delays. So first of all, we've already discussed there are policy flaws. Policies in Pakistan, they work as a top to bottom approach. They have never been opened for criticism of the private sector, of the academia, of the NGOs or any technological consultants. They are formulated at the level of the government, and then they are available for implementation. So that's why they lack implementation, because they are non-binding, non-inclusive, and they had not been gone through a proper process of policy formulation. So financial constraints are the bigger constraints for Pakistan. We have been getting serious economic losses due to natural disasters, and the increased cost of requisite policy changes have recently observed. So total NDC implementation cost estimated for the 2023 is around 200 billion US dollars for a country that is facing immense financial crisis. This seems to be very, very, very difficult target. So this is an area that needs to be addressed quickly, both by the Pakistani government and by the international community. So that we should be have some funds to implement our climate mitigation actions. So Pakistan developed a climate finance unit recently, but instead of mobilizing the international or national resources for the climate financing, this unit seems to be a monitoring agency only, and it has got least climate financing from the International Climate Fund. So India is the largest. Someone else's mic is on. Please turn off your mic.
इम्पैक्ट क्या होगा? ऑयल प्राइस इंटरनेशनल गिर रही है तो इम्पैक्ट क्या होगा?
I think we will take the questions in the end. Let me finish, please, and then I will take all the questions. So currently, India is the largest recipient from the International Climate Fund. It has received 5.1 billion US dollar in 2022 only. I hope that my fellow from India will correct me here if I'm wrong. So other challenges that we see is the lack of political will. Climate change has never been the political priority. It has never been included in any political party's manifesto, and it has never been worked at the political worker level. Then there are technological barriers, the policy, the current climate change policy. It has a detailed sectoral presentation. Every transport, energy, deforestation, every sector is involved in it, but it is very vague, unclear, and broad-based. Reason being that the years are not defined, the targets are not defined, and sometimes we see policy that says that we have to water transport is to be incorporated, and this seems to be very difficult in Pakistan because major provinces and major cities are land areas. So how can we introduce water transport in our country? So these are the issues, technological issues that are inherent in our policies. So we've already discussed the ineffective stakeholder management, and low social participation is another issue. People are more worried about their bread and butter instead of what is going to be happen to the planet in the next 1 year, next 10 years. So what could be the action plan of Pakistan? So we see that their top 3 climate performers, they are Denmark, Sweden, and Chile. And if we have to learn from the lessons, we see that Denmark is the top performer, and it has developed 5 very clear, distinct goals for its. So Pakistan is lacking in that. We have hundreds and hundreds of pages of our climate change policy. We lack clear goals in here. So Sweden has just 3 things incorporated. It has introduced the Climate Act, a budget bill, and a climate council, which is working wonders for the country, and they are achieving that. Chile is a country that has severely faced natural disasters, but it has started developing a pollutant database development, and that database is available for research and policy formulation. So I think these are the 3 areas that we need to address if we want to improve our policy formulation and as well as policy implementation. Thank you so much.
Due to the shortage of time, I will put all the questions to the end. And with this, I will turn to our next panelist, Dr. Sajjad Sarwar, to speak about AQI and respiratory.
Maruf, I cannot hear you.
Can everybody hear me? Hello? Dr. Sajjad, can you hear me?
Yes, Dr. Maruf, can you hear me? Walaikum salam. Am I audible to you? So, is my screen visible to all of you? Okay. My name is Dr. Sajad, and I am a respiratory physician. And as mentioned by Dr. Maru, what is my presentation is actually my research work, and I have correlated the air quality index with the respiratory disease mortality. So if we talk about briefly about the Pakistan Air Quality Life Index of Pakistan, here you can see that the South Punjab area of Pakistan lies in the region where the years of life expectancy is reduced by more than 6 years, according to WHO, because of the very poor quality index. Moreover, if you can see the trend from 2000 to 2015, the years of life expectancy is gradually losing, and we are on the rise. So, according to WHO Global Burden of Disease, the fraction attributed to air pollution, that 40% of COPD patients and 30 patients of lower respiratory tract infections and 19% of the lung cancer patients died due to poor air quality index. Due to exposure of the irritants, they got exacerbations, and that ultimately leads up them to the death. Here I belong to the Bahawalpur, and Bahawalpur is a place where you can see that it is also they are mapped out in different areas. The mean AQI of Bahawalpur varies accordingly, according to the different areas in the district. They have different mean AQI. And if we talk about our socio-demographic variables, then you can see there is a large population of female who are died due to respiratory diseases, most probably likely due to the indoor air poor biomass fuel exposures and poor air quality index and indoor pollutions. And if we talk about the age group, then you can see there is a step ladder pattern, and the more the age, there is increased risk of death due to poor air quality index. So we done the mapping of the patients of the Bahawalpur city to find out the areas from the where they are actually belong, so that we can find out the clusters and identify the factors which are involved in the poor air quality index. Similarly, we did mapping of the suburb areas and the rural population to find out the areas from where they belong. If we find out the temporal variation in the air quality index in the last 3 years, here you can see from the beginning of the 2021 to the end of 2023, there is a major huge difference. There is increase in death due to poor air quality, and you can see that during winter quarters, we are increase in mortality. And if we compare the 221 with the 22 and 23, there is a progressive rise in the deaths of the patient. Moreover, the mean AQI can be misleading because we need to identify air quality index in every month or quarter. That will give you a good picture of the health related issue. So if we correlate the AQI and death due to the respiratory disease in city, you can see that in fourth and first quarter, there is increased deaths due to increased poor air quality index. Am I audible?
Yes, yes, Dr. Sajjad, you are.
Okay, thank you. Thank you.
We cannot hear you now.
In the last, can you hear me now?
Yes, now.
Okay. If you can see the end of 2023, you can see there is a surprisingly high population who are dying with the poor air quality index. And if we compare with the 21, 22, and 23, there is a gradually increase in the number of population who died in the rural areas due to the respiratory diseases. Similarly, if we see the trends in each quarter, the poor the air quality index, the greater is the mortality rate. And we can see that in Q1 and Q4 of the year, there is increase in mortality as compared to the quarters with hotter temperatures. So the patients who died with the respiratory disease includes the most common disease was the COPD, which followed by pneumonia, ARDS, asthma, tuberculosis, and CLN. The next week find out the correlation with the disease mortality and the air quality index by chi-square. We find out the correlation in each quarter. We correlated each quarter with each disease and find out a significant relation between the air quality index and the mortality due to the respiratory disease. So what is the conclusion is that it is very pertinent while being in this region and while in Pakistan to make this emphasize on it that improvement in quality index will definitely lead to significant reduction in mortality due to respiratory diseases. And there is a lot of need and it is very emergent for the utilization of resources and health policies. And poor air quality is a big threat to health as well as economy. So we have done what our future perspective, we have done mapping of the patients to identify the local factors involved in the poor air quality index, which can be treated and with the help with own efforts, with the help of the local government, with the help of public awareness, which can so that we can improve mortality and quality of life. So the purpose is to join hands to improve air quality index. Thanks.
Thank you very much, Dr. Sajjad. And apologies for the disruption. Without any more disruptions, we will move towards our next speaker. Please welcome our guest speaker, Dr. Ajay Deshpande from India. Dr. Ajay will talk about role of science and technology-based approach in air quality management. He is currently the adjunct professor at the Ashank Desai Center for Policy Studies, Indian Institute of Technology, Bombay. Over to you, Dr. Ajay.
Hello?
Hello, can you hear us?
Yeah, I can hear. Please give me the share rights also.
Sure, sure.
And also the video. Oh, that's...
Dr. Ajay, now you're the co-host. You can share it yourself.
Just a minute. I will do that in a minute. Can you see my presentation? Hello?
Yes, we can see your screen, but the presentation we still cannot.
I couldn't hear you. Hello?
We can see.
Yes, we can.
Okay. So thank you very much. And I really appreciate this hosting of this webinar on a topic which is very, very critical for the subcontinent countries, including Pakistan, India, and the data which was shown by earlier speaker is really a eye-opener. All the entire region is in fact facing a problem of air pollution, mainly the particulate matter.
Doctor,
Hello.
can you see your presentation? It's just a folder, maybe.
Can't hear Dr. Ajay.
Dr. Ajay, I'm sharing your presentation. Can you see it?
And now it's visible, but I can't hear Dr. Ajay.
Noshin, can you see the screen, Dr. Ajay's presentation?
Yeah, we can see the screen, but audio is somewhere lost. Dr. Ajay, I think so. He is no more connected. We may have to wait for a while.
I think Dr. Ajay is not connected, so I would like to invite our next speaker, Dr. Shakil Ahmed Mirza. Can you hear me? Let me introduce Dr. Shakil. Dr. Shakil is a seasoned consultant physician, and he's additional executive vice president of PANA, an organization at the forefront of non-communicable disease prevention through awareness, effective legislation, and academia governance partnership. Over to you, Dr. Shakil.
Dr. Shakil, can
Hello. Good afternoon, everybody from Pakistan. And good evening, China and others.
Dr. Shakil, we cannot hear you.
Okay. Can you hear me now?
We can.
yes.
I hope you can share your presentation.
Presentation. Shall you display my presentation? Okay, thank you. So, thank you very much, CPDI, for having this seminar, and especially Ms. Noshin Khurram and Dr. Maruf, who have been bearing with me for the last few days. Actually, it was a very impressive lineup. And I just want to add on my take on the cardiovascular aspects of environmental pollution. Am I still audible?
Yes, Dr. Shakil, please go ahead.
Okay, then. So back to my presentation. Next slide. Dr. Maruk, can you move my slides or shall I have to do it myself? Yes.
Nosheen is controlling your slide. Nosheen, please.
Okay. Okay, then. So we are starting with just a brief intro, which I think most of the speakers have already done, that environmental stresses are mainly because of human activities, although climate change has a lot to do with it, and they can all contribute to the cardiovascular mortality. Next slide, please. We have shared the impact of the global pollution on the mortality and morbidity. And in areas like South Asia that we are talking about, most of the 90% of the our population is living in the environments where there's a lot of pollution. And that includes particulate matter, ozone, and so many other things. And the net effect of that is that this one of the most polluted areas also has a lot of deaths. More than 100,000 deaths are directly related to air pollution in Pakistan, which is a numbered figure, but actually figures are much more than this. Next slide. We are all very aware that this has a great impact on the health economy of the country. We are losing about 6.5% of our GDP because of this. And there is reduced dailies, productivity, and directly impacting upon the environmental sustainability and inequality and poverty, which is prevalent in our countries already. So apart from the fit and healthy, those who are really at risk for the environmental pollution are those who already have some sort of cardiometabolic disease like diabetes, high blood pressure, cholesterol levels, or lung conditions. Similarly, obesity is very prevalent in our countries, and these obese people are even at further risk of the environmental pollution. And then the frail and elderly and children, both of do not have much resistance left to bear the vagaries of this climate change. Next. We are all aware of the lung effects of the air pollution, like asthma and irritation of the lungs, like bronchitis, chronic obstructive pulmonary disease, even lung cancers. But much more important than that are the long-term sequelae, which lead to the cardiovascular disease. So I would like to go into a bit of detail as to how much damage is it causing and how does it cause damage. Next. Now, my next few slides are rather busy, but it is important in the sense that I just take you through as to what are the we need to move further.
Dr. Shik. Dr. Shakil, you are not audible.
Okay. Am I audible now?
Yes, sir.
Okay. As I was saying, that these next few slides will take you through the pathophysiological mechanisms as to what different types of pollutants or environmental agents can cause to our blood vessels, to our metabolic systems. They can decrease the blood vessel function, the oxidative stress is increased, and that leads to endothelial dysfunction, And then that leads to cardiovascular development of disease like high blood pressure, high cholesterol. Next slide, please. And this oxidative stress and also affects the hormonal levels. Our circadian rhythms are affected, that increase to high concentration of thickness of blood, which is called hypercoagulable state. And these leads to cardiac phenomena like heart attacks and brain phenomena like strokes. Next. Next slide, ma'am.
Sir,
Now this is
Dr. Shakil, you're not audible.
Dr. Shakil, you are not audible. Dr. Maru, can you listen us?
Yeah, he's not connected anymore, I guess. So shall we go forward?
We have a very bad internet connectivity in Pakistan.
I guess with this, with these issues, we can move forward and to invite again Dr. Deshpande. I hope he's connected now. And Dr. Ajay, can you hear me? Dr. Ajay?
Thank you. Thank you. Can you hear me?
Yes, sir.
Yeah. Yeah. Just give me.
We can
please
hear
give,
you.
please give me the sharing rights.
Ajay,
Yes.
can you see the presentation?
Yeah, I can see the presentation. Will you operate that presentation?
Yes, I can do that. Please go
Okay,
ahead.
thanks. Go ahead. So, thank you very much, and sorry for the disturbance. Suddenly, the power went off, and it took few minutes for me. So, essentially, I will start with the role of science and technology based approach for the air quality management. And as I was saying earlier, the entire subcontinent is really facing problem of air pollution, mainly the what we call particulates. And nowadays, we have moved from what we used to call it as a suspended particulate matter to particulate matter 10, and now we are talking about PM 2.5 and also now PM 1 also to some extent. So before going into the presentation, I think these are the three terms, or rather four terms, which are very essential to understand in terms of the air quality management. The first one is the non-attainment cities, and these are basically what we call air polluted cities, and we need to know the data for that. For 5 years, if the air quality is not meeting the standard, then it is called as a non-attainment cities. In India, unfortunately, we have more than 132 non-attainment cities, and this number is bound to increase because now the air quality monitoring is quite robust and the data is now coming in from multiple cities. When we talk about air pollution control, we have two terms which normally we get mixed. One is the mitigation and control. So control is at the source essentially, which is a preventive sort of thing. And the mitigation is normally away from the source, normally at the receptor level, so that the receptor is protected. The other term which normally is used in the air quality management is the hotspot. Actually, it is again a very numeric term where certain areas of a city are identified, and then you have to focus the air quality management efforts on those areas. And the last one is actually hyperlocal, where like hospitals or squares or traffic junctions, where instantaneous or short-term measures are really very critical, and they're or in fact, in the air quality management, we need to understand which are the areas which can be called as a hotspots and hyperlocal location. So with that, next slide, please. Next slide, please. Hello. Yeah. So another important discussions, in fact, what I heard also for a long time is actually the air quality standards. And India has its own air quality standards, which are notified in 2009. There is a great debate actually that these standards should be brought at par with the WHO standard. But those who are in the policy domain, they will definitely understand making a standards is not that easy. We need to understand the socioeconomic condition, our acceptability of those standards, our rather I will call it economic support to achieve those type of standards. All these factors differently decide their quality standards. So there is a huge technical debate on whether the standards should be made more stringent. But when we have 132 cities not meeting this norm, and what is the point in reducing the standard only for the sake of getting the standard? So there are multiple views on that. I'm not entering into that debate, but this is an area where a lot of efforts need to be concerned. Next next slide, please. So when we talk about air quality management, another important aspect is the monitoring. And that monitoring, some of the speakers earlier talked about, there are different types of it, like manual monitoring, what we call a very robust type of monitoring called continuous ambient air quality monitoring network, which is analyzer based. And now we have so many sensors, actually, what we call low cost sensors, ranging from Indian rupees 2,000 to 20 lakh rupees. Such a broad range is available. And that is also called as a low cost sensor, but 20 lakh rupees in Indian currency is not really a low cost type of thing. So the air quality management really depends on the availability of the robust data what we have. And what I would like to emphasize here is most of the cities presently in the subcontinent do not have the air quality network which is required as per the required frequency. Next slide, please. So in India, we have a sort of framework where the Central Pollution Control Board, which is a responsible government regulatory authority, they have decided how much air quality monitoring stations should be available depending upon the population. Unfortunately, this type of framework is not even available right now. But yes, there is a significant progress. We have more than 2,000 continuous ambient air quality monitoring stations being operated in private and the government sector, and the entire data is now fetched in a central server. Yeah, next slide, please. So we can see it here. There is a national ambient air quality monitoring program which is actually operated by the federal government but supported by the state governments, and there are different ways of doing it. The continuous ambient air monitoring stations monitor multiple types of parameters. Manual stations, actually, they are very few nowadays, but yes, they are also monitoring the data. But most importantly, the monitoring is done by multiple agencies. Next slide, please. You can see it here. There is a Central Pollution Control Board. There is a State Pollution Control Board. Then there is the involvement of the universities and research institutions. Can I get the next slide, please? Yeah. So universities are also involved in air quality monitoring on behalf of the state pollution control boards. There are different projects of various other institutes like what we call Council for Scientific and Industrial Research, Department of Science and Technology, India Meteorological Department. So different research projects also measure the air quality. And then obviously the embassies and consulates, they have their own monitoring stations, and that data is also available to the regulatory agency. But the issue is there is a lot of data which is coming in, and that most of the data is not really passing through the QA/QC procedure. And that type of data can definitely deflect the entire orientation of the ambient air quality management in the country. But at the same time, yes, the democratization of the data has helped the people to understand, or they are now speaking in the language of AQI and air quality. Now, practically every person in those 132 cities, they are aware about AQI. Everybody has a mobile app and they can see the AQI also. Yeah, next para, please. Next slide, please. So if you really think about the air quality data, then we need to think about different types of actions also. And most of the source apportionment studies, which I'll speak now, they talk about road dust resuspension as one of the major contributor, more than 52% in most of the source apportionment studies. So naturally, the dust is coming from different sources, including the construction related source. And in fact, most of the cities, because of the economic and other developmental activities, infrastructure development activities, they are facing problem about the dust in the country. But at the same time, there is a challenge how to collect that dust, how to dispose that dust. But yes, mechanical sweeping equipments are now available in most of the cities. They collect the dust day and night. And then, but unfortunately, there has to be research on what is the composition of that dust, what is the organic and inorganic carbon. All those things need to be carried out further. Yeah, next slide, please. So the air quality data is really important for the air quality management, particularly the pollution control at the hyperlocal location like waste burning site, construction areas, and a lot of focus need to be basically given to those hyperlocal sites. And nowadays there are standard regulation, there are guidelines available at the central government level where these hyperlocal pollution areas are actually monitored regularly. The data is available in the public domain. So next slide, please. So one of the important factor in the entire air quality management is the data democratization, whether the data is available to the common people. So presently, the ambient air quality stations are connected to the CPCB server at Delhi, and that data is available for everybody on the website, which I have given a link here. And also at the same time, the air quality index is also available on the website continuously. We can see that type of information. But at the same time, the stakeholders are identified, including the city officials, state pollution control board, traffic, health department, and advisories are also sent automatically through SMS, to WhatsApp, to email, to all these stakeholders in case of the what we call as a graded response action plan. If their air quality index increases, then automatically this action plan come into picture. Certain restrictions are put in place, and this is what we call as a GRAP, G-R-A-P, Graded Response Action Plan. Yeah, next slide, please. So now coming to the scientific part, already one of the speaker has already mentioned about the emission inventory and source apportionment studies. The emission inventory is really critical to understand the contribution of sources in a particular region. But what we can see here, the air doesn't know the physical boundaries of the cities or the state or the countries. So naturally, we need to follow what we call it as a airshed quality approach. And source apportionment studies actually help us to understand what source is contributing to the air quality to what extent. So both of them are complementary studies and they need to be carried out on a continuous basis. Yes, they are very costly, they are very robust and also skill oriented. But at the same time, now with a lot of technology available, the sensor technology available, there can be a continuous source apportionment studies, and this type of work is now presently done in National Capital Territory of Delhi, what we call NCR, and many other cities like Mumbai as well as Kolkata. They are planning about a continuous source apportionment studies, and emission inventories are edited every year per se. Yeah, next slide, please. So this is what emission inventory, more than 200 emission inventories are available in India. And their analysis is also available. I've given the link for that. But yes, they form a major source of information at the local level. The local agencies can work on, identify the important sources and try to control the source at the origin, so that the definitely the air quality improvement can happen. Yeah, next slide, please. So again, typical contribution, I'm sure this might be the same in Pakistan also. At the same time, some of the areas of India, like Punjab particularly, we have problem about stubble burning. But now with lot of judicial intervention, lot of regulatory intervention, and also some economic instruments which have been used to control the pollution from stubble burning, the instances are reduced significantly. And now there is a some sort of the farmers are quite happy with what type of economic support has been given. Instead of burning, they can give it for biogas generation, and that biogas generation can help them to get more money out of that. So there is technical data available. Next slide, please. Like CPCB, the nodal agency in the country, has issued guidelines for emission inventory as well as the source apportionment to bring the consistency and uniformity in the data across the country. So any state or any city, if they are carrying out this type of study, they have to follow the norms of the Central Pollution Control Board, so that the data is comparable, the results are also comparable to that extent. So coming to that source apportionment, what I will call it, emission inventory. Can I get the next slide, please? So this is what I spoke about. There are guidelines, and these guidelines are quite detailed one. People can follow that thing. Yeah, next slide, please. So source apportionment also I spoke about, and in fact, a lot of data is required. This is very costly in Indian currency. Normally, it costs about 2 crore to 3 crore rupees for a city, but definitely it is worth to get it, because then we can come to know what sources are contributing to what extent. And then at the same time, we need a lot of skilled operations for that. The local capacity can be developed through involvement of the local universities and the academic institutions in this regard. Yeah, next slide, please. So again, source apportionment has been used for multiple purposes, including assessing the causes of air pollution, then most importantly, design of the air quality action plans, evaluate the impacts of the abatement measures. Nowadays, we spend a lot of money on creating an infrastructure in order to reduce the air quality, but whether those measures are really effective can be assessed through the source apportionment studies. And then definitely airshed approach can also be definitely argued with this air source apportionment studies. Yeah, next slide. I think just take the next slide again. I'm coming to one more important aspect, that source apportionment is actually important, and it is done for multiple parameters. In India, we do it only for PM10, not for other parameters. And that's because this is very costly, and the criteria pollutant or the major pollutant, what has been observed is the PM10 only. But now some of the cities like NCR as well as Mumbai as well as Bangalore, they have started some work on PM2.5 also. But PM2.5 being anthropogenic will be more important from health perspective, but definitely it is very difficult to assess the sort of quantification of that as well as the source apportionment for PM2.5. Next slide, please. So again, in the overall air pollution control strategy in India, we have something called as a National Clean Air Program, what is called NCAP. We used to have so many programs earlier, but last 5 years, this program, NCAP, has provided a very unique opportunity for the urban local bodies, because the central government is funding to a great extent. Every year, the budget is around 4,000 crore rupees for the entire country. And based on your performance, you get incentives for controlling their pollution. And their multiple layer structure has been formed at the central, state, district level, as well as the city level, where different stakeholders are working together to reduce the air pollution. But at the same time, NCAP really focuses on the cities, not on the state or the country per se, but the aggregated impact definitely will be on the state as well as the country. But now the second phase of NCAP really focus on the state-specific action plan on an air-shared approach per se. And this air pollution control strategy talks about identification of sources and then source apportionment, what is their extent of contribution, and finally trying to reduce the quantum of pollution as well as improving the air quality through the use of emission inventory as well as the source apportionment studies. Yeah, next slide, please. So again, this is one important thing, because all said and done, people's participations, people's involvement is really crucial in the entire exercise. And this is where in India, we started with different missions like Swachh Bharat mission. And similarly, now there is Swachh Vayu Sarvekshan which has started in 2023. So cities are actually ranked based on the efforts they have taken for the air quality management, and they are given a lot of sort of prizes as well as publicity, and definitely people are participating willingly just to ensure that their city gets a medal or appreciation from the government of India. So this is one important factor, I think, which has a very solemn effect on the performance of the cities in the air quality. And there is again very detailed procedure. Different sets of people visit the city and check the actions taken. But this is a very subtle effort and which brings the population in the entire air quality management efforts. Yeah, next slide, please. I'll take 1 minute extra. So these are the actions. I think they are known to everybody. Different sectors are identified: transport, industry, waste burning, construction, residential, dust, and then different measures are proposed. But this use of source apportionment and emission inventory highlights which type of measures should be given priority and what type of technology should be used. Yeah, next slide, please. So the National Clean Air Program deals with national level interventions, particularly vehicle emission norms. We have what we call Bharat 6, which is equivalent to Euro 6. The fuel quality is also now equal to Euro 6, what we again call Bharat 6 here. And then we have CAQMS, which have been installed at multiple locations. But now in last 2 years, Government of India is promoting Make in India project. So most of the sensors and analyzers are manufactured in the country. At the same time, airshed approach is advocated, and public transport, metro, practically every city now is actually executing projects on metro, and renewable energy is one of the key. But at the same time, source specific standards or source specific technologies are also important. Like construction, what we call anti-gun smoking, then we have industry specific standards, solid waste. And this is one area where a lot of efforts are required. We don't have a single city actually which has an ideal solid waste management system. There are efforts, there are missions, there are efforts or technologies being implemented. But yes, solid waste management is one of the area where a lot of efforts need to be taken up. Yeah, next slide, please. So again, these are technologies. Smog tower, you must have read about Delhi smog towers, and then different small air quality sort of air purifiers or other technologies are used. But at the same time, some hi-fi technologies like remote sensing for vehicle emission inspection, as well as what we call Wi-Fi technologies. This is double pulse Wi-Fi technology, which are being used in some of the cities, but still they're under evaluation purpose. Next slide. While closing, in fact, I want to say here, the city action plan or air quality management is not an easy job. It has multiple stakeholders. It has different priorities. People have different priorities. And it's really good forum here today. We are having doctors and air quality specialists talking together. But at the same time, we need to involve people to the maximum extent. Unless and until people are involved, I don't think this aim will be achieved. The new areas like circular economy through what we call solid waste management, stubble burnings, construction and demolition waste. This is one very important economic instrument which can be used here. And that will promote the eco-entrepreneurship, and the air quality management can also create multiple jobs. And I think this is what the countries like India and Pakistan should think about. Definitely, this is a challenge, but at the same time, it is an opportunity also. The other important aspect is now no action plan can be complete without climate consideration. And once we are talking about air quality control, definitely this is going to benefit from the climate point of view also. So net zero, decarbonization, all these activities are going to be complementary to the air quality action plan. But at the same time, we have to think about just transition also. If we are talking about green transport or EV vehicles, I'm sure there are hundreds and thousands of people working in the garages, and what will happen to them? So today, the environmental issues cannot be dealt in silos. They need to be considered in totality. There is no geographical constraint, and the issues of air quality particularly are common for both the countries. And I'm sure with new initiatives in climate as well as circular economy, decarbonization, we will be able to tackle that to a great extent. So I stop at this particular point, but I have few questions which I am not able to answer so far. Just next slide, please. This is something like, who is the air quality manager of our city? Who we should hold responsible, whether it is the district collector, what I don't know what you call deputy commissioner, or it is a mayor, or it is we as a citizen are responsible for the air quality management in the city. But at the same time, we have plenty of data, plenty of air quality data. It's just coming every minute. But this cycle of data to information to knowledge to wisdom, I think we are missing something somewhere. And that's why we are still dealing with the problem per se. So thank you very much for giving me opportunity here. Thank you.
Thank you very much, Dr. Ajay. I believe great wisdom you have shared with us, and I mean, we are so inspired by the great work being done in India for the air quality. And I mean, I think the good part is that you're getting like good amount of funding for this, and I would like all the policymakers, all the researchers, academia people to please note down these great lessons from India and China. And although I can see that the big problem that we are also facing, and Dr. Zaim mentioned it earlier as well, that the cost of air quality monitoring devices and technology is big. So with other budget constraints, I really hope we can produce some low-cost devices, and people like Dr. Zaim and all other researchers, inventors can help us do that. And thank you very much, Dr. Ajay.
Thanks. I'm sorry for the inconvenience. Suddenly the power went.
No problem. No problem.
Thank you.
Thank you very much. And with this, the problem is we are actually ahead of time, so I cannot take any more questions from the I cannot ask any more questions from the speakers, and we cannot take questions from the audience as well. So, but lastly, I would like to say that we all.
Dr. Maruf, Dr. Shakil, I guess, rejoin, so we can give her. Oh, sorry. We can.
Do you think we have enough time? If you think we can spare more time, then okay.
If he is here, so maybe he can conclude his presentation.
Sure.
Can talk about.
Okay. Am I going to share his presentation, or you can do that, please?
But let me check if he's there. Although he's visible here, but is he audible or not? Dr. Shakil, can you please hear us? I think he isn't. Okay. Go ahead to conclude. I think so.
Okay, so lastly, I would like to say that we all deserve to breathe in clean air. We all have a right to good health and prosperity. Our future generations should have a nourishing environment to grow and build a successful nation. If other countries can clear their skies to blue, then we can do that too. All we need is a positive approach, political will, and some sense of responsibility towards our health and community. Thank you very much, CPDI, for hosting this valuable webinar and several other initiatives on the air quality issues. And please don't forget to share your feedback after this session. Thank you, our honorable speakers, for your efforts and time. Thank you, audience, for your attention and participation. Please take good care of yourself. And sorry for all kind of disruptions. I believe when you have obstacles, you become stronger. And with high morale, I would like to say goodbye, everyone. Allah Hafiz. Assalamu alaikum. Thank you.